Hello. Today I am going to do a presentation on the link between chronic illness and depression and the unique relationship between the two, because it is a unique experience. I'm Amanda Pratt, licensed clinical social worker, a therapist focusing and specializing in chronic illness support, licensed in Alabama, Florida, and Michigan. So what we're going to talk about today is why is it so common to have depression when we're sick? We're going to talk a little bit about understanding what clinical depression looks like and how we distinguish that. I like to use an analogy with depression, especially with chronic illness. Some people call it a downward spiral. I call it getting stuck in the pit of despair. If you've ever seen the movie Princess Bride, you'll get that reference. So we'll talk a little bit about what pulls us into the pit of despair, or what leads us into the pit of despair. And then how do we get back out? How do we start working our way back out of the pit once we recognize that we're in it? And what protects us from falling back in it? What kind of protective things can we do? So first, we're going to talk about the overall prevalence of depression and chronic illness, which is really important to give us context surrounding how depression is different when you live with a chronic illness alongside depression. So first, depression is highly prevalent when you have a chronic illness, more so than the general population. So the rate of depression in chronic illness is roughly 2 to 3 times higher than that of the general population. And this can be, we can get more specific about what those numbers are when you look at specific chronic illnesses. There are conditions where that could be higher, sometimes upwards of 40% or more. And so generally speaking, it's about a third. So this overlap between depression and chronic illness, this relationship is bidirectional, meaning it goes both ways, and we can't really isolate the two from each other. Chronic illness can influence and cause depression, and depression can influence and worsen and or cause chronic illness. So oftentimes this is why it feels so muddy when we're trying to tease them apart, because we really can't. So one specific illness, people with spondyloarthritis have an increased risk of depression within that specific illness category. And what has been found is that about 40% of patients will have mild depressive symptoms, and moderate to severe depression is found in about 15% of that condition. So one element that influences that increased risk is the chronic pain component. And there are studies that show that patients with chronic pain will have 3 times a higher likelihood of having depression. And again, depending on your chronic pain condition, that can be even higher. So there is a significant link and relationship between chronic illness and depression. So what influences this relationship? Well, one of the things that I see is, first and foremost, if you already had depression prior to your chronic illness developing, your depression that was pre-existing will likely worsen as a result of having a chronic illness. Sometimes it can make your chronic illness symptoms more severe, and your chronic illness can make your depression symptoms more severe. Another thing I see is it depends on medications or treatments you might be on. Sometimes medication side effects can absolutely influence or worsen or make it more likely that we're going to experience depression. And so that is something, that needs to be taken into account in with respect to your overall quality of life. You can also have new depression. I have a lot of clients who have never had depression before. Then they developed a chronic illness, and now they have depression. And this can be for a number of reasons. We know that having inflammation as part of your chronic illness cycle can lead to new onset depression. We know that if your chronic illness has chronic pain associated with it, having chronic pain signals can over time influence your emotion signals that also happen in your nervous system and in your brain, and it can deplete neurotransmitters that we need to protect us against depression. So these processes over time can cause depression. We can have disease processes or changes related to our disease, like brain changes and things like that, that can influence and cause depression. And another thing I think most people don't realize that I'm always harping on is sleep. Having sleep problems alone can cause new onset depression. So these are all things that are linked with new onset depression. Then we have just your general circumstantial or stress-induced depression, okay? This is where all of the crap that we live with chronic illness comes in. The systemic problems, right? The gaslighting, having to repeatedly go into the medical system and encounter, failure after failure or misdiagnosis or failed treatment or what have you. This leads to something called learned helplessness, and that is a real phenomenon that everybody with chronic illness that I know or have met, myself included, has experienced at some point, and it's a really difficult aspect that can absolutely lead to depression. Grief can lead to depression as a component. The social isolation, the fact that we maybe can't get around as easily, or, we struggle to function the same way we used to. Any of those repeat negative experiences or the shrinking of our circle of life, you could say, poor quality of life, can also lead to depression. So that leads me to, okay, how do we know if something is considered clinical depression? Well, some of the things that I look at in therapy is, what are a person's normal mood states? Because depression can be experienced, or a depressed mood can be experienced as a part of our normal kind of ups and downs. It might be a reasonable emotional state to be in given something that's happened. We also might look at, is the depression better explained by saying this is grief? And grief is a normal emotional state that we might experience when we have a significant change that accompanies a loss of something in our life that we cared a lot about. So that can be a normal experience that has depression as a component. We also want to look at, is the depression better explained by a medication someone is taking or a disease process mostly, where treating that disease or changing the medication could alleviate the depression. And then we have what we would consider a true major depressive episode as part of a major depressive disorder. And sometimes we can have all of these and major depressive disorder. So major depressive disorder, as we define it in the DSM, we look at a period of over 2 weeks or 2 weeks or longer, and we say, okay, how many of these symptoms have you had? The more of these symptoms you've had, the more likely it is to be a major depressive disorder. We also look at, how significantly is this affecting your ability to function? The depression symptoms in general. And is it not better explained by any of these things? Or is it so pervasive and so severe that these things can't only explain these symptoms and there might be a depressive disorder on top of it, right? So these are all things we look at in therapy, and everybody's situation is unique and different. So what does this look like in real day-to-day life, right? If you were to try to spot it for yourself, it could look like maybe you have regular ups and downs, but your downs lately have lasted way longer. They've been much more persistent, and it's not getting better on its own like it might usually, or with the things that you usually try. We're talking an extreme inability to anticipate happiness, to get in touch with any feelings of joy at all. right? Extreme and pervasive. We're looking at, are my thoughts overwhelmingly now more self-critical? Are they more pessimistic? Am I ruminating more on like negative experiences that I've had? Do I have a lot more feelings of worthlessness, self-loathing, feeling like I'm a burden on others, hyper-focusing on that? Are my thoughts focusing on life being over or ending? Sometimes we might call it passive suicidality. If someone says something like, oh, I just wish I wouldn't, wake up tomorrow. It sounds like a very passive way to kind of disconnect from life, right? That is something that we look for. I think some of the other things like the physical symptoms, chronic fatigue, pain, sleep problems, and appetite shifts, I try not to focus so much on those because those can also be better explained by chronic illness symptoms. And it can be hard to tell the difference, but those can be symptoms of depression. And then if your treatment plan is working, if you're going to the doctor and your blood work is all right and your treatment plan is working objectively, but you're like, I still am not feeling better emotionally, sometimes that can be a sign that there's depression there. So I put together this basic depression model after working with chronic illness for a long time, and I use this sometimes to help demonstrate to people how depression living with chronic illness is so pervasive and why it seems like an inevitability that it's just something we're going to experience. So okay, the pit of despair is like in the middle there, right? When we get caught in this cycle and we can't get out of it, that's what I describe as the pit of despair. The more and the deeper we get in this cycle, the harder it is to get out. So at the top here, we have like in a normal depression, I would say pathway, you're going to have some stressors up here that might lead to depression, a depressed mood, and then this cycle ensues. But one of the things that I describe to people, and these could be biological stressors, psychological stressors, social stressors, right, is the nature of these stressors is heavier and more pervasive for people with chronic illness. So it often looks like this. Okay. So we have so many different stressors going on that depression interacts with all of them. So our job is to, usually we look at this cycle and we go, where can we interrupt this, right? In between here, there's a lot of different points at which we can interrupt it. But when you have chronic illness, you could interrupt this cycle and like eliminate this bottom half of it. But we still have all these things we have to learn how to live with. And that is why, part of depression management is chronic illness management. We have to do both at the same time and find a balance of things that will reduce each of these areas as much as possible. And the rest that we can't control or change, we try to manage it so that we stay up here and we don't go down here. So the biological stressors are things like, our disease processes, our medications, any energy deficits that we might have or restrictions or limitations. Psychological stressors that we might have unique to chronic illness are like the grief and loss around not being able to do things. The mental fatigue can be emotionally upsetting. Trying to figure out, am I disabled? Am I not? Grappling with the idea of adjusting to being a person who's disabled, medical trauma, worries about the future. There's a lot of psychological stuff up here that is stress. And then social stressors, the idea of losing our friends, not being able to get out and do the things with our friends or our social supports that we might want to do. We have the greater social culture around chronic illness. We sometimes, lose our ability to work or go to school, and our social circles just naturally kind of shrink. And so we have less social exposure. Sometimes our peer group or our work colleagues don't treat us well. And then we have a lot more negative social experiences. So these things are all stressors that can perpetuate and lead to more and more feelings of depression. And so once we experience depression, how we respond to it, or the natural thing that we might do even to manage our illness, even if we think, I'm not choosing this for my depression, but this is what my illness necessitates, can lead to us getting in this cycle. So for example, I'm depressed, I have all of these stressors going on. I now withdraw from activity because let's say I am just struggling to function. Okay. And I do it because that is the safe thing for me to do, or just the necessary thing for me to do because I'm sick. Now I naturally also have a loss of reinforcement. I have a loss of social positive experience. I have a loss of, positive experiences that might be meaningful to me. And now my experiences are more and more difficult, overwhelm, distressing symptoms or discomfort, which worsens my mood and makes it more likely that I'm going to avoid things more and more, which leads to more depression. And all of these things cycle us into the pit of despair. So this is kind of how it happens. And when we're looking at what can we do for depression, the big picture is that there are protective factors, and then there's also the multifaceted approach we take with chronic illness and depression, and we try to address as many of these factors as possible. So the big picture is that research shows that if you are responding to treatment, if you have a good support system, if your symptoms are managed well, you are more likely to experience either mild depression as a result of just the reality of that stuff up there, or no depression. On the other hand, if you have poor treatment outcomes, if you don't have social support, if your symptoms are not well managed, if you have poor quality of life, you are more at risk of moderate to severe depression. So now we get into what can we do? And there's a lot of stuff in here that I was not able to put in the presentation. If I could narrow it all down into a 20-minute presentation, that would be great, but I can't. So I am going to give the overarching things that we always recommend and try to explain why these things help. And still, even if I'm working with someone with really complex illness needs, I always teach them, go back to your basic needs. Go back to the basics of your self-care routine first and evaluate that, and then we branch out from there. So exercise and sleep. Okay, exercise, and it doesn't have to be exercise in the traditional sense. It can be any physical activity. Even dancing has been shown to be significantly helpful for depression. One thing to keep in mind when you have chronic illness is if your chronic illness affects your ability to function, and doing the physical activity that you are subscribing or prescribing for yourself, that you're deciding to do, or that you've decided with your doctor or physical therapist, anything that helps improve your baseline functioning is way more likely to also improve your depression. Okay. I always tell people, check with your doctor, start with low impact activities. Your specific illness is really going to dictate what kind of activities are safe for you. But any physical activity has been shown to help with depression. Sleep, I've already kind of harped on it a little bit. Always check your sleep hygiene. Sometimes sleep is more than just our sleep hygiene. Our sleep problems are more than just our sleep hygiene because, our illnesses can really affect our ability to sleep. But honing in on your ability to get good sleep can really make a difference between being depressed and not depressed for some patients. The next couple things I recommend are obviously when you have chronic illness and depression, sticking with a treatment plan or advocating for a good treatment plan is important because a good portion of this depression is going to be disease related. It's going to be fixing your quality of life through helping manage your disease symptoms. So that's really important. And then, eating healthy foods. And what healthy eating looks like can be different depending on different illnesses and your ability to do certain things with regard to food prep. But generally speaking, anti-inflammatory, antidepressant foods are what I recommend for mental health purposes because depression and inflammation is so linked. And most antidepressant foods like dark leafy greens are also anti-inflammatory. And that is not a coincidence. So, eating nutrient dense foods can be really helpful for depression. Then we have this other category that is always big with chronic illness. I put stress and pain management together because if you are managing your stress, you're also managing your pain and vice versa. So managing stress and pain levels are very important because obviously stress leads to depression. Chronic pain leads to depression. And so how we manage and cope with stressors can influence how we feel. And, in that cycle that leads to the pit of despair, this can make a big difference. So I go way in depth in sessions with clients with this. But generally speaking, I teach people to figure out or learn about the difference between emotion-focused coping and problem-focused coping. Emotion-focused coping are things like mindfulness and acceptance, relaxation exercises, anything that helps regulate difficult emotion experiences. Problem-focused coping is going to be more strategic and instrumental. It's going to be planning. It's going to be problem solving. It's going to be taking decisive action to address problems in a systematic way. So I like to think about it as the difference between what can I do about the stressor itself to change it or remove it or mitigate it? And how do I feel about the fact that this stressor is here and I'm having to deal with it? And so we want to be doing things for both sides of that. Then we have our social side of self-care. So leaning into your supports. If you already have a social support system, leaning into them and learning things like, healthy boundaries and how to communicate in a vulnerable way and let people in so that they can support us the way that we need them to, and they can learn how to do that can be really helpful. Also, if your supports are limited, because sometimes they are, and they may not understand what it's like to live with a chronic illness, seeking out support groups like this one can be really important. And also therapy, right? Therapy is another type of support that you can add in. So you have a lot of different buckets, right? We can't expect one bucket to be everything for all the different things we go through in life. And so having different buckets of social supports is helpful because, then we're not relying solely on one, which puts an immense amount of pressure on the social support. And if we're not getting what we need, we might feel more and more resentful that bucket is not giving us what we need. So communicating openly, spending quality time, really important to figure out how to adjust to your needs while still connecting with your social support system. So if you're used to going out and doing really active things, but you can't do that anymore, then, adjusting to having your friends come to you or do things that are more low key or less intense in terms of the activity can be really helpful in allowing you to connect with your supports in a different way that honors what your illness needs are. And then, if you don't have social support, really important, also a lot of work, can't take that out of it, but really important to start building a new network of social supports that can be helpful. Not having support at all is a big risk factor for depression and worse outcomes for chronic illness. So it is worth the work, I promise. So beyond all these, if you're doing all these things and your depression still is really difficult to live with and it's not responding to those types of recommendations, then that means you might need a higher level of care. And so this is where I usually recommend, hey, have you thought about an antidepressant and talking to a psychiatrist or your primary care provider to try one? Antidepressants are not a bad thing. There's research that has shown that taking an antidepressant alongside doing therapy and these other things can make such a huge difference. It can actually double the effectiveness of that antidepressant. So sometimes we need that extra boost of an antidepressant to get us back to where we need to be so that we can do these things to help manage it and have a better long-term strategy. So don't be afraid of trying antidepressants. There are also other treatments if you can't take antidepressants, alternative treatments that you can try. I've had clients who've done really well with TMS. I've had some clients who have tried ketamine therapies, and even approaching it from like a specialist perspective and like honing in on pain management or honing in on physical therapy or anything like that that's specialized and focuses on a particular area that you might need help in can also be helpful for the depression. So just real quickly, last slide, how can therapy help if you have a chronic illness and you're experiencing depression? All these things are things we work on and we individualize, for each person. So these are general recommendations always, but when you get into the nitty-gritty of what does your specific situation look like, that's when the magic happens, right? So we do things like processing grief associated with illness, figuring out a strategic plan sometimes for how to broaden your social support system, how to advocate with medical professionals, how to set reasonable goals and action plans, how to pace, how to integrate your illness needs into your life and make changes so that everything better fits, right? We might talk specifically about anxiety or panic or things like that. So we really get into the nitty-gritty. We really get specific about what might work for you. And so that's where therapy really helps. And then also just having that extra space, that extra bucket to talk about things that maybe you don't get to talk about anywhere else helps. So that's it. I hope I didn't take up too much time. I planned on 20 minutes and I know we went over that a little bit. I also created a worksheet with even more information on it. So that way you can kind of think of it as like a check-in, something that you can walk through and be like, okay, what are some things I can do? How does this work? What are some tips for implementing this? And so hopefully that helps. And then I also included a stages of grief worksheet that is chronic illness specific that I really like and I share with my clients. And that can also help you place sometimes your emotional experience within, is this a grief and loss type of thing? And where am I at? And how am I doing with this? So I hope that helps. I don't know if